According to the Occupational Safety and Health Administration, or OSHA, lack of training has led to an increase in fatal workplace accidents. For this reason, we should be aware of the importance of safe work practices for the sake of both our colleagues and ourselves. Welcome! We are going to talk about the importance of safety in the workplace. Remember, safety is everyone's responsibility. What are the goals of this training? To understand the importance of safe work practices, to identify safe work practices, and to analyze the consequences of not following safe work practices. What is OSHA? OSHA, which is an acronym for the Occupational Safety and Health Administration, is a government entity that ensures safe working conditions for all workers by enforcing safety and health standards. What is personal protective equipment, or PPE? Personal protective equipment, or PPE, is intended to protect the worker from risks that may threaten their safety or health in the work area. Personal protective equipment is vital because it can prevent accidents from happening to the worker, such as skin burns, eye burns, slips, future hearing problems, head injuries. What is PPE? Chemical-proof clothing. This item not only prevents us from getting wet when cleaning machines, but also protects us from chemical burns. Helmets. These protect us from possible impacts to the head. Slip-proof boots. It is clear that these help prevent us from slipping. Protective eyewear or goggles protect our eyes from possible damage caused by chemicals or foreign materials. Earplugs or ear protectors are required by law when the operating noise exceeds 85 decibels for 8 hours or longer. If the company provides us with ear protectors, it is because the noise produced by machines and equipment could cause hearing damage in the long term. Procedure. Roll the earplug with your fingers until it resembles a small, thin roll or cylinder. Pull the top of the ear up and back with the opposite hand to straighten the ear canal. The cylindric plug should be able to slide entirely into the ear canal without any problem. Hold the earplug in your ear using your finger while counting to 20 or 30 out loud. This will be enough time for the earplug to expand and fill the ear canal. Once the plug has fully expanded, your voice will sound muffled. Chemical protective gloves protect our skin from possible burns produced by contact with chemicals. Note: all PPE will be provided by the company. Emergency shower station. What is an emergency shower station? It is a piece of equipment used in case of an accident involving chemicals. We use these showers when a chemical is spilled on us. This is an example of an emergency shower station, and this image shows a sign indicating the location of an emergency shower station. Procedure. Pull the operating lever of the emergency shower. While underwater, remove clothes, shoes, and accessories. Wash any contaminant that had contact with your body. Stay underwater for at least 20 minutes while your supervisor calls for medical help. Emergency eye wash station. This is an example of an emergency eye wash station, and this is an example of a sign that indicates the location of the emergency eye wash station. Procedure. Press the lever to open the water tap. 1. If you wear contact lenses, you should remove them immediately. 2. Place your face correctly in the eye wash with the water outlets facing towards your eyes. 3. Keep your eyes open. 4. Adjust the water pressure in the eye wash to prevent damaging your pupils. 5. The eye wash should last at least 15 minutes. 6. If necessary, call the emergency services. 7. Cover the eyes with gauze. Proper lifting technique. First, spread your legs to shoulder width apart. One of your feet should be slightly in front of the other to keep good balance. When bending, it is essential that you always keep your back straight. Bend your legs to avoid arching your back. When lifting the box, always use both hands. Use your legs to lift the box. You should never use your back to lift, as you could hurt yourself by doing so. Bring your elbows as close to your body as possible and face forward. Bring the box as close to your body as possible. When you reach the area where you need to put the object down, you must bend your knees to lower the object, always keeping your back straight. Make sure the base of the object comes into full contact with the ground before releasing it. Never use your torso to change direction, as you could hurt your back. Use your legs when you want to change direction. Injuries at work. In the event of sustaining a cut, if possible, we should not move from the place we are located. This will avoid contaminating the area with blood. Hand cuts are the most common type of cut. What we must do in these cases is apply pressure to the cut to decrease blood flow. Then, we bring the injured hand close to the chest and ask a colleague to call the supervisor. If you do not need serious medical attention, your supervisor should have a first aid kit, where you'll find things like Band-Aids or adhesive bandages to isolate the injury. These Band-Aids are usually blue and have aluminum foil inside that is detectable by a metal detector in case a strip falls into the product when you are working. Pictograms. Pictograms are symbols located on chemical containers. This one, for instance, indicates the chemical is corrosive, which means that if it gets in contact with the skin, it could cause burns. Chemical containers must have a label indicating the name of the chemical contents, and they must contain other requirements established by OSHA. One of these requirements is the hazard statement, which indicates the risks associated with exposure to this particular chemical. There is also the personal protective equipment statement, which establishes the PPE you need to wear to reduce harm or risk of injury. Secondary container. What is a secondary container? A secondary container includes several units of the primary container. Here is an example of a secondary container with capacity for several units of the chemical. On the other hand, this is an example of a primary container. Note that both are labeled to meet OSHA requirements. Here is another example of a secondary container. Labeling chemicals allows us to know what substances are in the containers. This is important because the mixing of certain chemicals might be harmful to workers' health. Also, labels inform us about the care and precautions we should take when using the chemical. Safety data sheets. Here we can find information about chemicals, such as pictograms, the hazard statement, the personal protective equipment to be used, and the conditions under which the chemical is to be stored or kept. Chemical spill pallet. The chemical spill pallet is used to collect chemicals from the primary container in case the primary container breaks. For elevations of 3 feet or more, we must use a ladder, so we must always inspect the condition of the ladder. Maintain 3 points of contact. 1 hand and 2 feet, or 1 foot and 2 hands should always be making contact with the ladder. Face the ladder while climbing. Only place ladders on a level surface. The ladder's surface should be free of any slippery material. In this type of ladder, it is vital to make sure that this part is secured correctly. Lockout-tagout. Lockout-tagout is a safety procedure that consists of disconnecting the power source from the equipment and machinery before performing any maintenance or sanitation. After disconnecting, the employee should place locks to prevent the machine from being turned on, and tags indicating the machine is under maintenance or cleaning. This lock should be removed only by the person who placed it. Among other things, this tag or label must include the name of the person who placed the lock. Another way we can define lockout-tagout is a security procedure designed to block or disable the passage of energy. LOTO, or Lockout-Tagout. The Lockout-Tagout course is essential to our job when operating machinery or equipment that uses a power source. We always have to have in mind that we cannot underestimate the potential dangers of the energy source or ignore the risk of accident every time we operate machinery. The types of energy we work with function in different ways, so every time we perform maintenance, we should keep that in mind. We should always lock and tag machinery when it requires maintenance so that other people cannot turn it on while we work on it. This way, we can assure we are taking care of our health and going home safely. The objective of this course is to understand the principles and procedure practices of lockout-tagout, or LOTO, isolating energy through lockout-tagout to prevent accidents. This procedure must be followed by everyone who takes part in the process, including the production, maintenance, storing, and quality teams. This is an example of a machine that needs to have the lockout-tagout procedure. Under no circumstances should we put our hands above or between the conveyor belt, as this is considered a dangerous maneuver. For this reason, the lockout-tagout procedure exists, where we must block power from the machine before putting our hands in between the conveyor belts to perform any maintenance or sanitation. Forklifts. We must be aware of where forklifts are while they are operating inside our work area. We cannot assume the forklift's driver is watching us, since this is not always the case. Forklift drivers have some blind spots, which means that in some situations they cannot see us. It would be wiser to wait for 2 or 3 seconds for the forklift to pass. The most important thing is that we get home safely. If we have these lines on the ground of the facility, we should always follow them while walking to avoid forklift accidents. Machine guarding. Machine guarding is used to prevent accidents. Any worker can be injured by moving parts of equipment that do not have this protection. For instance, a machine that uses automated knives. The intention is to protect the employee from possible injury. Here we can see the automated knife machine. In this image, we can see an example of machine guarding. Injury and Illness Prevention Program, IIPP. The Injury and Illness Prevention Program, or IIPP, consists of reporting all accidents and unsafe conditions to your supervisor, reporting defective equipment, and participating in safety trainings. Always remember, we are all responsible for identifying hazards in the workplace and notifying the appropriate person. COVID-19, or coronavirus. Coronavirus is an infectious disease that can lead to serious respiratory infections. The virus is transmitted from person to person through respiratory droplets. These respiratory droplets are produced when we cough, sneeze, or even talk. We can also become infected by handling a surface or object that has the virus on it, and then touching our mouth, nose, or eyes. In this experiment, we can see the difference in several situations between wearing a mask as opposed to not wearing it. These small dots can show us the presence of the coronavirus. When sneezing, we can see that without a mask, the infection possibility is much higher than with a mask. When singing for a minute, here we can see the difference in wearing a mask as opposed to not wearing one. Speaking for a minute, the conclusion is similar to the previous one. By coughing, once with a mask and a second time without a mask, we can see the difference in both cases. As we can see, the use of a mask will help reduce the spread of the virus. Some other experiments show how the use of masks protects us from infection 73% more compared to not using masks. Control and prevention. Wash your hands with soap and water frequently for at least 20 seconds. In case of a lack of soap and water, use sanitizer with at least 60% ethanol or 70% isopropyl alcohol to clean your hands. Avoid touching your eyes, nose, or mouth. Maintain a minimum of 6 feet of social distancing if possible. Wear masks or a mouth cover. Avoid touching the mask while wearing it. If you do touch the mask, wash your hands or use an alcohol-based sanitizing gel. When you take off your mask, do not touch the front part. Take off your mask with the loops around your ears. After taking off your mask, wash your hands or disinfect them with alcohol gel immediately. Please remember, the use of sanitizing gel does not replace washing your hands for 20 seconds with soap and water, following the correct procedure. Sanitizer is recommended only when soap and water are not available. It would be counterproductive if we wash our hands and do not disinfect our cell phones. Our cell phones could have as many microorganisms and viruses as our hands. The CDC recommends using wipes or sprays containing at least 70% alcohol to disinfect our phones. The 3 most frequent symptoms produced by this virus are fever, dry cough, difficulty breathing. But in addition to this, there are also other symptoms, such as diarrhea, muscle and body aches, fatigue, nausea or vomiting, headache, the loss of smell or taste, sore throat, a congested or runny nose. If you have any of these symptoms, especially the first 3, please do not go to work, but notify your supervisor immediately. At this point, we have learned the importance of using personal protective equipment and following safe work practices to prevent accidents that could happen to both us and our coworkers. We hope you liked our training, that you find what you have learned today useful, and that you can implement it in your work area. One more thing. Always remember, we are all responsible for safety at work.